Profractional resurfacing is probably one of my favorite laser procedures. Number one, because of the quick downtime. Within about 3 to 4 days, you are back to normal and you can go back to work, put on a little makeup, and go. Uh, but it also has some great results for especially lines and wrinkles, for acne scarring, for pigmentation. So it does a number of things all in one. I highly recommend Profractional laser resurfacing for anyone that has very little downtime. You can do it on a Friday and pretty much be back to work on a Monday. I will also tell you that Profractional is a little bit scary. The first day, you look horrible. You think you're basically a burn victim. But the great part is that you heal very, very quickly. And within about 3 to 4 days, you've got a new layer of skin that's coming up. It looks great, and the results continue to get better with time. You really don't see the full results of Profractional until probably about 3 to 4 months down the road. That's when I usually tell patients that they can repeat it again, especially for acne scarring. If you want an overall rejuvenation, then just repeat Profractional about once a year. How Profractional works is that it burns these tiny little holes into your skin. It burns anywhere from about 30 to 120 holes per square inch, depending upon the settings. Um, these holes are burned very, very deeply, and they actually stimulate collagen regrowth. It leaves about 80 to 90% of your skin normal to grow into the holes very quickly. So that's why you get the quick healing time. The old way of resurfacing your skin was that the laser would burn off your whole skin, and it took you about basically 2 weeks to recover, and you'd have to apply bandages and gauze and do vinegar soaks and things like that. Whereas Profractional, you're back to normal in about 3 to 4 days. Plus, you get great results without all the downtime. The old way of resurfacing, when it burned off your all of your skin, you would be red actually for even months after the procedure, 3 to 6 months after the procedure. Whereas with Profractional, you're only red for about 3 to 4 days. So much less downtime, still great results. I will also combine Profractional with other laser treatments for a better result. Profractional can be combined with a micro laser peel, and that works really well for acne scarring, for improving the skin texture. Profractional can be combined with an IPL or intense pulsed light, and that is mainly for patients that have a lot of pigmentary issues, a lot of superficial pigmentation, sun damage, um, superficial veins and redness. Doing both together is like adding 1 plus 1 equals 3. So considering combining Profractional with a laser procedure, and you'll get a better result out of it. A lot of patients ask me, Dr. Nguyen, what's the difference between Fraxo and Profractional, or Profractional and CO2 fractional resurfacing? The reason why I chose Profractional is that Profractional can be done on any skin type, from 1 through 6. It can be done on the lightest skin, and it can be done on the darkest, blackest skin as well, without injury to the skin. Um, some of these other laser procedures can't do that. And Profractional actually has, I think, a much quicker healing time. You are back to normal within 3 to 4 days. Other treatments, for example, CO2 laser resurfacing, a lot of patients will remain red for even a couple weeks after the treatment, whereas Profractional, the redness goes away very quickly and you are back to normal. The disadvantage of Profractional is that sometimes it can be a little bit more painful than the other CO2 fractionated laser treatments. But it's kind of like in the middle ground. Fraxel is probably the most painful out of the laser treatments, the fractionated treatments out there. Profractional is probably in the middle as far as pain is concerned. CO2 probably a little bit less painful than Profractional. So anyways, that's my scoop on why I choose Profractional over the other laser treatments.